Good afternoon, colleagues. Good evening and good morning, wherever you might be. I would like to start this briefing, this IASC briefing. I would first of all like to warmly welcome all of you who have joined us today. And I really hope you are keeping healthy and safe. These are not easy times. I'm Tanya Schumer-Cross, and I'm delighted to host this meeting today. We're focusing on the Inter-Agency Humanitarian Evaluation on gender equality and the empowerment of women and girls. A rather long title, and I hope I will do it justice. We're thrilled to learn more and exchange thoughts on the IAHE on the empowerment of women and girls. And we welcome the evaluation's aim to enhance learning around gender and humanitarian programming across the humanitarian system. And please note, this is the first thematic evaluation commissioned by the IASC and the IASC Evaluation Steering Group. The IASC Secretariat is committed to broadening the visibility of IAHE findings to all stakeholders. But I have to start, forgive me for that, with some housekeeping. First of all, the meeting will last approximately 90 minutes, and we are following the following structures. We have a short introduction, then we have about half an hour, a little bit more remarks by the panelists, and then we have Q&A with the audiences, where panelists will also respond to all your questions. And then we have some very brief closing remarks. Please use the chat box to communicate with each other, but also to file your questions. We'll respond to all the questions in the Q&A following the meeting. And please note we are recording the webinar, and you can follow up on today's briefing by going to our website. And please ensure you mute yourself with your videos off. We need to protect the bandwidth of some of our colleagues who have logged on. It's with great pleasure that I'm warmly welcoming our presenters today. We have three presenters. The first will be Dr. Terrence Jantzi. I hope I'm pronouncing your name correctly. He has more than 35 years of experience working in the field, but also as an academic. He has worked in development, on humanitarian response, and on peace building and programming. He's a senior evaluation specialist for the KonTerra group, an independent company which implements evaluations for a wide range of UN agencies and other humanitarian and development clients. He has also most recently led evaluations for WFP, UNICEF on various countries, for the Peacebuilding Fund, and for OCHA on the duty of care evaluation. Prior to this, Dr. Jantzi worked for several international NGOs, including World Vision, Terre des Hommes, and the Mennonite Central Committee. Our second presenter is Ms. Mariangela Bizzarri. She's an experienced international consultant with expertise on gender, protection, and gender-based violence, GBV, developed over 20 years of work in humanitarian and development context, the academia, and also the private sector. Mariangela specializes in research and analysis, training, design and delivery, and strategic planning. And she's successfully combining practical field experience with solid research and analytical skills. Through GenderConsult, which was founded in 2011, she has been successfully providing integrated responses to client organizations in collaboration with professionals from multiple backgrounds. Finally, we're joined by Mr. Ali Buzurokov. He is representing OCHA's strategic planning, guidance, and evaluation section, where he manages the section's evaluation and oversight portfolio. Prior to this role, Ali worked as the head of analysis and monitoring unit in New York and as a humanitarian affairs officer for OCHA's regional office for Central Asia and the Caucasus. Prior to this, he was an emergency health official with UNICEF in northern Pakistan and with UNFPA's emergency response section in Geneva. A warm welcoming to all of you. Thank you for joining and briefing us today. Just briefly, I would like to recall, please use the chat box to share your thoughts and to flag your questions. And please mute yourself. Questions will be answered following the presentations. Let us dive straight in. Ali, I would like to start with you. Can you tell us what is an Inter-Agency Humanitarian Evaluation? And why was it critical to undertake one on gender equality and the empowerment of women and girls? Over to you, Ali.
Okay, can you hear me?
Very well. Please go ahead.
Okay, thank you. Um, uh, it's a pleasure to be here today to share the results of this very important interagency evaluation for many reasons. And I also would like to thank IASC Secretariat for supporting and promoting interagency evaluations of humanitarian response. IHEs are independent assessment of the results of collective humanitarian response by IASC member organizations, usually to a specific crisis, or as in this case, to a theme. The basic idea is for the evaluations to answer the question, how well we collectively did, and how well did we follow our policies and guidance, what went right, what went wrong, and what can be improved. So the primary objective is to improve our collective learning and also to promote accountability, mutual accountability, but first and foremost, accountability to affected people, national governments, but also to more general public. IHEs, this is the abbreviation for interagency, for this long abbreviation, for this long name of interagency humanitarian evaluations. Part of humanitarian program cycle. They're part of humanitarian response, just like needs assessment, strategic planning, or resource mobilization. This is a part of humanitarian response. And as the other parts of the humanitarian program cycle, it is focused on collective rather than on any specific sector or organization. The IHEs are managed by interagency steering group for humanitarian evaluation, which, the membership of which mirrors largely the IASC membership, but not entirely. And the group is chaired by OCHA as a neutral broker. And this model had been fairly successful for over a decade of experience. And now that the development system is going through reform, a lot of the discussions in the development sector indicate that they really would looking to this group's experience with the system-wide evaluations. So the group has conducted many crisis-specific evaluations in the past, but over time it was decided to expand these evaluation activities to thematic IHs because a lot of issues that we want to promote in the humanitarian response are cross-cutting, and they recognize as a critical factor in the humanitarian programming, like protection, gender, but also because focusing on the cross-cutting issues helps to address policy issues and at the global scale. So the group decided to conduct the first thematic evaluation on gender because it was in the follow-up to Agenda of Humanity, where we collectively looked at all the priority areas and realized that all of our organization, or most of our organization, had gender on top of their priorities for the next 2 years. It was also new Secretary General's priority, ERC's priority, and so there was unanimous consensus that this should be the first thematic focus. And lastly, we knew that this evaluation will be finalized in 2020, which is a special year for gender. For those working on gender know it's 25 years since the World Conference on Women and Beijing and the Platform of Action. It also the 5th year of implementation of Sustainable Development Goals that includes gender equality goals. So for all these reasons, it was a good timing for us to do this evaluation on gender. With this, I hand over back to Tanya.
Thank you very much, Ali. Thanks for this solid introduction. Terrence, I would like to move to you. You have led many evaluations already. Can you tell us why this one was important to you? Why did you become involved? And secondly, please walk us through the methodology of this particular IAHE. Over to you, Terrence.
Thank you, Tanya. This evaluation is interesting because it comes at, I'm trying to remember in Spanish they say a coyuntura, a coming together of multiple events at a specific point in time. Ali has mentioned some of them, but on this slide here, this has actually been building for probably about 4 decades. And so I'm feeling kind of old these days, so I remember all of these decades, and so I tend to ramble about this, but it may not be that interesting to everybody else. But back in the 90s, there was some of the first, well, it wasn't the first, but there was a sort of a consolidated body of research coming out about the unequal effects on women in humanitarian crises and development. So the same responses experienced differently by different populations, and women were particularly vulnerable. So this led to a wide variety of interests in funding projects related to women. My wife and I used to joke back in those days that if you wanted a project funded, all you had to do was write in the proposal gender or environment, and it would be funded. But it was sort of a surge in interest in that period. This is highly simplified, by the way, so I'm simplifying all of these different things. Obviously, things happen before and after as well. And then in the 2000s, you started to see this emergence of policies and handbooks, both interagency and agency ones, that were trying to provide a little bit more structure. The 90s funding tended to be a little bit more ad hoc, widespread, and so the 90s the 2000s, they were starting to try to build some structured policies around response. And then coming into the 2010s, we started to see the emergence of capacity development tools related to gender. So there was a GenCap project, which is one of the more important ones, sort of the surge capacity for senior gender advisor deployment to support humanitarian responses. There was the development of different tools for analyzing projects in terms of, it's called the Gender with Age Marker. It's gone through several revisions now. But the 2010s were kind of this period of developing some of these tools. One thing that's not mentioned on here is 2012 was the establishment of UN Women as a specific UN organization, which you could consider capacity development for the entire system. Then 2016 was an important point because during that World Humanitarian Conference Summit in 2016, the member states came together to build some gender commitments, both in humanitarian response and development. Sorry. And this was a sort of a fairly important point because it was the actual member states of the UN and donors coming together and developing collective commitments towards gender. This led then to, in 2017, immediately afterwards, there was a flurry of revisions or updates on the interagency gender policies. There was the development of a gender accountability framework, revisions on the gender handbooks, the tools. So there was a number of things that happened right after the summit. So and then then in 2019, 2020, as Ali said, there was interest then in saying, so how has all of this infrastructure at the interagency level translated to the ground, to the actual feet, the hands that are dealing with the frontline response on these humanitarian responses? How have we seen all of these things actually operationalized? Has it trickled down in any way, or has it stayed up high? So what has been some of the changes? So it's quite interesting time to see this sort of slow, I wouldn't say slow buildup, but a buildup over multiple decades, coming into a fairly much more coherent structure and infrastructure than had been before. I can ramble more, but I'll save it for the question and answer period if there's more interest in some of this. But that's building on this. What made it interesting was looking at some of these things for the point in time that we are historically. Going to the next slide. So I won't go into the large scale methodology details. If you can read they're all available in the report, but essentially we looked at two different levels: the global interagency stakeholders, so that would cut across all the humanitarian response infrastructure, and then we also did deep dives into 10 specific humanitarian responses, and looked more deeply either through deep literature review in the green countries or literature review combined with field visits and interviews in the blue countries to sort of understand how all this has played out in the responses themselves. Again, I can go into more details if there's a question answer, but basically a combination of global and case study analysis to try to build observations about how well this has cascaded. Over, back to you, Tanya.
Okay, thank you very much, Terrence. Mariangela, I would like to move to you next. A number of important findings have come out of this evaluation. Would you please share with us the key elements and findings found at country level and talk us through the results? Thank you very much.
Thank you, Tanya. Yes, thank you for the opportunity, and I'm very glad to be here today to share with all of you the findings of this important work that we did all together. I will concentrate now on the findings at the country level mostly, and then Terry will talk about the more global ones. So to start positive, a very interesting finding, and glad to see that, was evidence of certain progress being made in gender mainstreaming across humanitarian responses, and particularly the one that we visited in person or the one that we analyzed more in detail in the desk review. There is definitely much more attention, at least in the time frame that we have been focusing on, more attention to gender issues and gender considerations in the design and the delivery of the response. And certainly also some efforts to ensure a little bit of expertise on the ground when responding to emergencies. This progress can be related to some key factors of success, for sure, starting from the one at the interagency level, since this is an interagency evaluation. Definitely the adoption of the new Inter-Agency Standing Committee Gender Policy and the related accountability framework, in 2017 played a role. Together with that, I would say also other already existing tools that they have been evolving over time. For example, the gender with age marker, an instrument that have been used throughout in emergency response. And along with that, also the efforts made by all the different organizations that are part of the Inter-Agency Standing Committee and the humanitarian community at large. So efforts in terms of policy development, strategic focus, and the development of different guidance and tools also at the cluster level globally, but then of course with an important implication also at the country level when it comes to the establishment of the clusters. Some other factors of success that we were able to identify are the presence, particularly at the humanitarian country team level, of senior gender expertise. This definitely played an important role in the gender mainstreaming in the response. The commitments made by, again, the management at the country level when it comes to gender, both in terms of, for example, addressing some of the priorities identified. I can give you the example of Nigeria because I was the country lead there. There were clear examples of specific priorities being identified and clearly addressed by decisions by the management itself. The establishment and functioning of specific coordination mechanisms when it comes to gender. For example, we had various names and various examples, but the gender thematic group or the gender working group in humanitarian action when it came to, I think it was in Bangladesh, or other structure of a similar nature, that they were providing a little bit of coordination and collaboration among agencies beyond the cluster system and, the protection cluster or the GBV area of responsibility. And then also the presence of gender expertise already integrated into the specific cluster by decision of different cluster lead agencies. Next slide, please. So despite all of this, and together with all the progress that I mentioned so far, there is something that is quite, probably not new to most of you, but, is still very much there. Gender is not taken as a priority in the early phase of the response, and therefore is in most of the countries that we considered, we realized that it's largely absent, especially at the very beginning of the humanitarian response. So it's rarely deployed in terms of expertise when it comes to start responding to emergencies, and particularly the sudden onset responses. The fact that it's not prioritized means that it's not perceived in general, and this is, cause effect at the same time as a life-saving issue. So you see progress, but more when the emergency develops further, so more for a protected emergency. And this, of course, has important implications when it comes to, the quality and the extent of the gender analysis and understanding on the ground, and what you see actually integrated into the needs assessment, but also, the humanitarian response design and delivery. So very often you do have a little bit of understanding, you do have an initial collection of data that are disaggregated by sex and age at minimum, but very little use of them and very little capacity to actually analyze and use them to inform the programs. Next slide, please. This is also very, the aspect about the gender analysis is also very much linked to the extent to which women and adolescent girls, I would say, are actually included and engaged when it comes to understanding the needs and priorities of affected population on the ground, but most importantly, I would say, when it comes to making decisions about their life and the type of response that is more appropriate, most appropriate to them. What we've noticed is that, yes, there is definitely a progress in terms of engagement with women and girls, particularly at the beginning, for example, during needs assessment, plenty of consultations being made on the ground. The challenge is then to translate this consultation into, first, a very systematic process, something that continues throughout the humanitarian response cycle, meaning, like systematic engagement, and two, more meaningful type of engagement, meaning, involving them in decision-making when it comes really to programs and how to implement them and what they need most. And also like in terms of what is their capacity at times to contribute to the response itself. This also played out in terms of feedback and complaints mechanisms. That is also part of the programming cycle. Again, we have seen a lot of progress, interesting one, in terms of establishment of multiple communication and information sharing mechanisms, trying to reach out to different population groups, which is a positive development. But as compared to men and boys, still women and adolescent girls are less capable and have less access to most of these mechanisms for different reasons, different type of barriers. Illiteracy, mobility constraints, insecurity, and so on and so forth, and lack of privacy or, confidentiality, etc. And another aspect related to this is also, the extent to which people do receive a feedback about their own feedback and complaints. What happened to their feedback? What is actually done by the different organizations, which is also like a key element that is still very much missing. Again, on a positive note, we notice in some contexts that the support being provided to the establishment and functioning and engagement of different women's group and youth group, particularly when it comes to coordination structure, when it comes to funding mechanism, when it comes also to assessment and reaching out to different population groups on the ground, has been very helpful in increasing the level of engagement of women and girls and providing more voice and influence. Next, please. So I think this is the last in terms of findings at the country level. No, I still have, yes, this should be the last. Some other gaps that we identified is that at times, we do have gender expertise on the ground, and this expertise is actually deployed and is given priority to. What we identified is sometimes a disconnect between what is happening at the strategic level, for example, at the humanitarian country team level, humanitarian coordinator level, and what is actually happening more at the operational level in terms of, of the different clusters and how they work. So being the humanitarian community in most of the contexts that we observed, being very reliant on gender advisors and temporary deployment of gender expertise, like the GenCap. Very often it happens that they're either deployed at the strategic or at the operational level, and when the two are not well combined and they're not well integrated, this is of course leaving some gaps behind. So, for example, in some contexts, it was really clear that, that the effort and the input of different type of advisor and expertise at the strategic level, but a little bit less so at the operational level or the cluster level. This heavy reliance on GenCap advisors, as I mentioned, these are temporary deployment of gender expertise, is, of course, it has a lot of very positive impact and effects, but it's also like short in terms of vision and in terms of investment, because most of the time, the same moment in which the gender advisors leave, means that a lot of the initiatives and activities are left behind. Another aspect that was identified as a gap is also the fact that, yes, at times working group and coordination and collaboration structure, they do exist, that they have a specific focus on gender, they do exist. But first, that they work mostly as an information sharing platform and not necessarily, at the same level of the cluster. And two, they're very often disconnected from the operational decision making. So again, the cluster system or the inter-cluster coordination group. Over to you, Tanya. Thank you.
Thank you very much, Mariangela. Terrence, I would like to turn back to you. We've heard a lot about findings now, but can you help us to better understand what they mean for us? Do we know why we found these elements, and what do they mean for our response in the future? Thank you. Over to you.
Sorry, I had forgotten to unmute myself as I was talking there. I would say if you could move to the next slide. Thank you. So looking at some of the, that's the wrong, that went backwards. If you could, there you go. So there's a few factors we looked at structurally, and I think this is what we were circling around to in much as at all these levels, is that gender is often a priority, but not integrated into the structures in a way that it's systematic or normalized. If that's a very general statement, but there's a number of places where this intersected. So for example, we take the IASC level, gender is not as visible in the structure, plans, and management processes, even though it's in the priorities as it should be. So it's a stated priority, it's often discussed, but when you actually look at the where the structure is, where it's located, the gender reference group is located, where if you look at the associated work plans, if you look at the management structures, the reporting or accountability structures, it's not as visible there. So it becomes a little less visible in I would say, the documentation processes. So this is one factor. So that's at the IASC level. Next slide, please. Should do that more smoothly, I guess. But so the other thing is that if you look at the existing accountability mechanisms, and there's a wide variety of tools already available, gender is not as strongly integrated into these systems. And again, let me give you what has happened then as a result of this is that there is a dependency on voluntary leadership committing to gender to say, but it's voluntary commitment. And while it's important for leadership to be committed to gender, it's not sufficient. It's necessary, but not sufficient for wide-scale gender application. When you rely on voluntary behavior change as opposed to making it just part of the system and structure. So, for example, the Gender Accountability Framework that was developed in 2017 with the policy, they produce a General Accountability Framework report every year, and they make recommendations against the gender policy from what they find from all of the gender, from reviewing all of the humanitarian responses. There's actually not any institutionalized follow-up on this report. There's no management response. There's no reporting on application of the recommendations. So it's a very broad report that becomes optional in some sense because there's no systematic follow-up. Gender, another example would be like gender is not included. For example, the one place where humanitarian coordinators come together to talk horizontally about issues in common is the HC retreats, they're called. So these happen every year. Gender's never been a topic or a theme that the humanitarian coordinators discuss in these retreats. In this place, retreats probably not the right word for what happens there, but in these spaces. Gender is also not a standing item on the agenda for the member states or the principals at the IASC level. So it's not treated as a standing item. It's not treated in these retreats. There's no management or institutionalized follow-up on the report. There are four so what we will call non-negotiables in the humanitarian country team accords. They're all related to gender, but they're what we call subsectors. There's protection and accountability to affected populations, GBV, PSEA, but not gender as an entire theme. And then there's some useful tools that could be adapted to provide humanitarian responses real-time assessment, but they're not real-time. They take can you I think the slide moved unless I'm can you move forward to slide okay, you can move to the next slide. Right. Is this okay? I feel like we missed a slide here, but and then sorry, I lost track of myself here. And so the tools don't exist in real time for the HCT to review their gender success in the same time as they're developing their new humanitarian response plans. And so the real time element it's always delayed about a year and a half from the actual response. And so this makes it difficult to use these tools systematically in the planning process. So there's a variety of subtle things like this that they're not what I would call sexy things, but I think they are indicative or reflective of a sort of a gap in the structure in the systems that would really operationalize gender. If you can move to slide number 12. So then the the final element here is that there's been we observed an implicit assumption that gender mainstreaming is something that can be addressed without resources, including for expertise. And I think this was one of the things we were highlighting quite a bit, is that the expertise element is pretty important. It's not just having funding for the projects that have gender components, but also applying funding to staff the structure sufficiently to provide gender expertise. And so we have seen, this is a positive thing, we've seen an increase, this was actually came from the study funded by or sponsored by the UNFPA and UN Women, looking at funding in related to gender across these humanitarian responses. It came out at about the same time as our evaluation. It was quite interesting. So they noted that there has been an increase over the last 3 years in requests for funding of GE gender-related programming, but the degree of funding of these requests is less than the average of the responses. So it's underfunded to a greater, disproportionately underfunded compared to the rest of the response funding coverage. But it seems like to some extent the real key, the real sort of point of investment would be on resource allocation to interagency gender expertise, both at the cluster level and at the strategic level. When that was there, everything worked much better, worked well. But when that expertise was not there, it was left to voluntary commitments by a whole range of technical sectors that aren't necessarily gender experts. It didn't work as well. The problem is that tracking the resource allocation for this kind of gender expertise is really difficult in the way the current system is set up. It's not set up to isolate or track or monitor where this money is going, and so it makes it very difficult to do real-time monitoring of progress against this. So I would say these are kind of the sort of system gaps that have prevented the cascade. The cascade has happened to some extent, but it takes a long time, and it is very weak at the initial frontline response, the initial onset. It becomes better over time, but part of that reason is because of these system gaps. Sorry, I rambled too much farther there. So I will turn it back to you, Tanya, and pass the word to Mariangela for the next section.
Yeah, but please feel free to ramble more. It's very interesting, despite it's a sobering account. So Mariangela, I would like to move over to you again. The evaluation also found many good issues. Maybe you can share with us some of the good practices found during the evaluation.
Yes, next slide, please. Thank you. So yes, one of the key objectives of this evaluation was precisely to identify some good practices and some key lessons learned for replication, but also, to leverage to the extent possible also for future humanitarian responses. Some of them I mentioned already while talking on the findings. So this is also an opportunity to summarize a little bit, what we noticed, both at the country and global level. So again, repeating what Terry was saying right now, the level of expertise and the presence of gender advisors and dedicated attention to gender at the humanitarian country team level and also at the coordination cluster level really made a difference, and that's definitely a good practice. Everywhere we notice the presence and the contribution of this senior gender advisor, there was evidence of progress being made, and we had a series of examples also in the report in terms of better understanding, better capacity to engage with women and girls on the ground, better capacity also to translate all the information related to gender into relevant programs and more adequate programs capable of responding to the needs of all. So a series of different examples. Then another good practice at the country level was also the capacity of leaders, but also different organizations and the humanitarian community at large to really translate some of the commitments made, more at the global level when it comes to gender, really making gender a priority, to translate those into the country context and really to adapt those commitments to have that level of understanding of gender-related issues to then being able to translate that into the actual response. And finally, as I mentioned already previously, it was particularly key, and that was interesting to see, anytime we saw that there was some specific expertise deployed at the cluster level, by under the initiative of the agency-led cluster. These also brought about a lot of success in terms of better understanding and better capacity to integrate gender consideration into the work of the cluster. That was also related to the fact that, and that was also the result of some of the interviews we had, when a gender expert, he's working alongside the cluster people, that capacity and that expertise was also able to translate issues related to gender better in the same language that cluster people could understand. So it was also like, acting as a translator, or also like processing gender better for people at the cluster level to understand. At the global level, some of the key factors of success and the good practices, definitely the development of tools and the policy, the accountability frameworks, and other related tools like the gender handbook, for example. I mentioned already the extensive use of the interagency gender with age marker, and it's, the previous version, and also the development into the gender and age marker. And then certainly the availability and deployment of GenCap advisors in different humanitarian response. Next slide, please. So again, in terms of key takeaways, gender expertise is very much needed. So again, it's not only is not possible to integrate gender effectively without resources, but it's also not possible really to integrate gender within humanitarian response unless we have the dual approach that we always talk about. So gender mainstreaming on one side, but also like dedicated capacity on gender is also very much needed, and the two should go hand in hand. And also the timing is critical. We mentioned before that, over time and more in protracted emergencies, you see gender as an expertise being deployed, or gender as a priority being considered, but not necessarily in the early phases. Well, timely deployment in the early phases of the emergency response is very critical for this. Gaps in the standard humanitarian infrastructures, I think Terry covered that a lot in terms of globally, where gender is positioned within the interagency standing committee system, but also like at the country level, we mentioned already the fact that very often coordination structures are disconnected from the rest of the decision making when it comes to the operational response. Similarly, when it comes to accountability to gender equality, very often you see on paper that gender is given priority and is, very often mentioned in the agenda and the TORs also of the management structure, but there is no accountability system in place. So we were asking, for example, some of the people and decision makers whether they are requested to report back on gender results and outcomes, and this is not yet the case. There is certainly the need to strengthen further the participation of women and girls in decision making, so really to inform the programs and for them also to be able to be part of their the response to their own needs. And then these, the fact that very often gender is still very much reliant on the personal understanding, individual commitments, and capacity of individuals to implement it, rather than being really like a capacity that exists and is, developed throughout the system. Over to you, Tanya. Thank you.
Thank you very much, Mariangela. Maybe a quick note to all our participants. Would you please already put your questions to the panelists in the chat? Thank you very much. Terrence, I would like to move over to you. Can you talk us through what are the key evaluations, the key recommendations from the evaluation, and how does it help us to better integrate gender equality and the empowerment of women and girls in future programming? Thanks.
Well, thank you. Well, we have some very specific details on the evaluations, but if I think if I had to summarize all of this, it would be something like when you see the lack of gender cascading down, or I mean, there has been success. So when you say what are the barriers, it's not really a lack of priority. It's not a lack of commitments, and it's not a lack of interest. Where it seems to be is these more subtle systemic components, systematizing. So we have a lot of the infrastructure, we have capacity development tools, I noticed how much people still rely on voluntary commitments. They would often, during interviews, they would still ascribe sort of the reason why things aren't cascaded down to like, oh, well, you know, people just aren't interested in this, or, oh, it's not a priority. But as far as we can tell, it is a priority. You look at from the member state commitments all the way down, you see it stated as a priority, but it's not reflected in the system. And I know this is a more boring place to provide recommendations, but it's kind of the place that we saw that would help. So these are the general categories, but one of the things, for example, is just enhancing the management response to the Global Accountability Framework report. Right now, the report doesn't actually have it's developed, it's produced, it's disseminated, but nobody's responsible for doing anything about it. Like who does the recommendations? Who follows up on the recommendation? Who reports about the follow-up of the recommendations, and who do they report to? That whole management response is very important. If you're producing a report and you don't have a management response, it actually says something about how much that report will actually influence anything. The response is where you, and I mean, speaking as an evaluator, that's where you end up seeing changes happening from an evaluation. Now, it's not a solution in the sense of you can have a management response and nobody chooses to do it, but at least somebody's thinking about it. It's a first step. The other thing was, strengthen meaningful participation of women in decision making. So if you think about what Mariangela was saying, that we saw things at the basic level of getting data from women during the needs assessment. And we saw something a little bit around getting data from feedback mechanisms, complaint mechanisms, but we didn't get to the next level. We didn't see the next level up as very systematic, where there was the deliberate inclusion of women in the decision-making about their lives. So if you talk about in psychology, Maslow's hierarchy, the next step up would be strengthening that piece. There's also then, so expertise, we're gonna hammer this again. It's not just, it's the timing of the expertise, where it sits, who it is, but there did need to be both a strategic level expertise dedicated, present, like a senior gender advisor at the HCT level, and some gender expertise that sits within the operations to be able to speak the language of the technical sectors and that these two levels of expertise need to be connected to each other. And then just we also have made some recommendations around shifting the gender group. There's a gender reference group within the structure of the IASC, but it doesn't sit at it's not aligned to the same level as what would be reflected by its normative mandate. If you look at sort of some of these structures. Let me just think. So these were sort of our general categories. If you could move very quickly to the next slide. Let me just see. Yeah. So this, I also wanted to touch on this one a little bit. The recommendation 1, we also have more details on this, but really, if you look at the longer the response is there, you can almost guarantee that the better the gender integration will be. So time makes a difference, but it was consistent that the moment of the frontline response, gender was very weak, always. So that seems to be, if you're thinking about these structures and systems, the system around how we organize ourselves for the sudden onset frontline response, the first 72 hours, the first 2 weeks, first month, that seems to be a place where there could be a lot more. If you're going to focus your time and attention, that would be one of the places to look at. We made a few suggestions around that. Can you go to the next slide? The other two I've already mentioned. So, and then, yeah, we talked about the accountability framework report. Also, then within the IASC structure, just making it more visible. Can you go to the final slide here, which is tracking the accountability and then also improving the tracking of resources. So how do we know, especially for expertise, how do we know that we're actually making a difference? If you look at the resourcing systems, it's very hard to get that answer quickly. It requires a very detailed, long-term sponsored study to answer a question of, are we investing the resources for expertise appropriately? So we, again, very sort of structural issues, but it seems like this is the point what could be worked on. So we don't have to worry about prioritizing our interests or commitments, but we might want to work on some of these internalized systems more. And thank you. That's probably more than enough information just in a virtual presentation. So I'll pass it back to you, Tanya, for the next step.
Okay, excellent. That gives us plenty of time to also have a conversation with our audience. I see that we have the co-chairs of the GEEWG, the Gender Reference Group, actually in the audience. Julie, would you maybe want to come in with some comments? But I don't want to put you on the spot, but please do take the floor if you wish.
Hi, Tanya. Yes, thank you. Happy to just give some very brief comments. And firstly, to thank the interagency team for this really important study that consolidates a lot of our knowledge. I think that for some of us, for those of us who've been working in this sector for many years, I don't think there are any surprises, but it's really important to have it written down and to be able to use this evaluation as a tool for moving forward and for really taking this to the next level. Some of the things that have stood out, I think, for me as chair of the GRG, and also just my other hat is the senior lead for Oxfam's global humanitarian team, the senior gender lead for Oxfam's global humanitarian team. But, you know, we talked about I like the articulation of the need to remove systemic barriers, because I think that's really what it is that we're talking about here when it comes to gender. And so as GRG, looking really at the piece around accountability, because we are responsible for the accountability framework. So looking very closely at the important recommendations around moving this piece forward, I think is really important for us. And then connecting to the connecting back to the country and to the regional, to the GEHAs, the gender and emergency action groups that sit at different regional levels. How do we make sure that technical expertise is there from the start of a response, and how do we make sure that becomes sustainable? What is the role of the GRG in this? I think is going to be really important for us to look at moving forward. I would stop there for now. I'm happy to answer any questions that come our way, but I'm interested in hearing from the group in terms of how this translates for them and if they have any suggestions and recommendations as well. But I again, really thanking the team for some very practical recommendations that we will be able to take forward. Thank you.
Thank you, Julie. We have a question from the audience. There has been investment in the DEM coding. What were the findings related to this? Does the GEM coding indicate an increase in investment in principal programming? Was the team able to look at any of the GEM 3 projects to determine effectiveness, relevance, and impact? I pass over, maybe Terrence, can you comment on that?
Yes, sure.
Mariangela, please jump in as well.
So I'm not sure which one of us will take it, but I think this was actually, I'll say first and then Mariangela can come with details, but this was actually covered by the UNFPA UN Women funding study to a much greater degree. So we were abstracting from them rather than replicating what they had already done. Their conclusions were that it's difficult to still track this very easily. And it's very, but and also to determine the effectiveness, relevance, and impact remains a challenge. Were their conclusions. Mariangela, I'll pass the word to you to supplement that.
Yeah, maybe just a clarification about the approach that we took, being an interagency humanitarian evaluation and looking at the humanitarian community and response at large. What we did was really looking at the different tools and what we call the building blocks of the response, collective response. So, for example, we looked at the gender with age marker as one of the existing tools, the extent to which, for example, people on the ground do know about that and has been using that throughout the design of the response and delivery of the response. We didn't go too much into the detail of the results at the programming level. So yes, the influence when it comes to gender responsive programming, but more like collectively again. So that level of detail, as Terry mentioned, was more, we rely much more on existing studies and consideration also made by those implementing the marker itself. Over.
You just mentioned the details of the findings. Perhaps as we have few comments so far coming in, you can give us a little bit more detail of what you found at country level. What were the specifics coming out from some of the country studies, which were rather diverse? You spanned a rather broad spectrum of countries.
Sure. Mariangela, you have, she had to step away here in a few minutes, but I'm not sure if she's still here. Go ahead.
Yes, maybe I can say something. I can share something about Nigeria and Iraq, the two countries. Yes. Okay. Interesting from the Nigeria experience was precisely that aspect about the engagement of women and girls and the support that has been provided by the humanitarian community at large to the establishment and functioning of women's group and women's-led organization. Because Nigeria was really like a good practice in that respect. There was an intentional effort being made, by the humanitarian country team to move forward on the localization agenda, and particularly the engagement of women's group and youth group. And that led, for example, to the, first of all, the establishment of a network of women's-led organization, which didn't exist before. And one of the reasons why it didn't exist was that these groups were already there, of course, and they were working at the community level, but they found a lot of barriers when it comes to entering existing networks of different civil society organizations, particularly by the men-led organizations, that they didn't want them to be part of the same network or collective. So there was an effort in that respect to establish like a women-led organizations collective or network in different states in the northeast of Nigeria, and that was successful. And there was also like an intentional effort to engage different women's group during the humanitarian needs assessment, overview development, and also later also the design of the humanitarian response strategy, which was a multi-year. So it's not the plan, but the strategy itself. So just to share, like a good practice from Nigeria. Something interesting we saw in Iraq was on the feedback and complaints mechanism. So again, and talking about engagement of women and girls, there having one main feedback and complaint mechanism that was joined among all the different humanitarian agencies was seen as particularly positive because, first of all, it had, it took different forms depending on the context and provided different channels for affected population to rely on and to report back to. But at the same time, it was managed jointly. So there we saw, a good practice in terms of how also response could be provided to the different groups providing their own feedback by using and relying on one mechanism. Over.
Terrence, do you want to add anything to this?
Yes, thank you. Just responding to one question in the chat, Mahamuna had asked if the study, the UNFPA, UN Women's study that was referred to, yes, that's the link to that publication. So it was very interesting and detailed in terms of looking at some of the funding questions to a much deeper level. Within the countries, I'm going to go back to the expertise question. It's not expertise, yes or no, and it's not having a gender and humanitarian action coordinating structure, yes or no, but it was how and who and where this sat that was important. So we looked at the responses, and out of all of the responses we reviewed, almost all of them had developed or had put together some sort of gender coordinating group or coordinating group for gender. So this isn't a requirement in the humanitarian infrastructure, but they all did it voluntarily. But one of the things we saw, though, was that often this coordinating group, it focused largely on raising awareness, spreading information, rather than being able to provide technical input. Or if we have expertise, so for example, sometimes the members of these coordinating groups, they weren't gender experts, they were often nominated as gender focal points. So they would be treated more, they would often be nominated more junior personnel. And every now and then they might be asked to comment on a product, but they weren't necessarily positioned senior enough to actually influence the decision making that a cluster was going to be making. And so this was one of the things we saw was that it's not a yes/no question, it's a who and how and where. It's a little bit more subtle, but it was a very positive indicator that all of these responses that we looked at did want to have some sort of coordinating group. I mean, so it did emerge even though it wasn't required. The other interesting, so I've been saying this about the expertise, but I would just want to clarify, it's not enough to say, oh, we'll get a gender focal point and that'll sort this out, or, oh, we'll put a gender expert in here. The other thing, and I've told this example many times, so for those who are listening multiple times, but going back to that sudden onset response, so we saw this in, so we looked at Bangladesh with the Rohingya response, and that was relatively new. It was one of the newer responses. And there were people there who still had institutional memory from like the first days on the ground from the technical sectors. And so there were some of these technical people were saying, so I'm a health person and I'm being deployed right away to do life-saving on health. And, and he says, so we try to do what we can with what we have in the time that is there. And then the gender person is deployed 6 months later. And he said one of the implications of this is that there's two implications, and I thought this was quite important because it's subtle again. The person comes along afterwards and then provides feedback on what was built, but this gets viewed as gender now is the person who comes along and tells us everything we did wrong. And so that automatically creates a negative reaction to these people. They're not there at the moment that all this work was being done. That's part of it, but they came along later and are seen as the criticizers. So this sets them up to fail in some sense in terms of their deployment. And the second thing was because when you're there at the front line at the initial time, you build a sort of a team mentality there, and then this other person comes along and needs to integrate into a pre-existing team. And so these two, so coming along and being seen as the criticizers and coming along and being seen as the outsiders, kind of didn't help the gender experts being able to be utilized to their maximum extent. And so the timing becomes really crucial about when. So it's not just like, oh, we ought to deploy a person now, but if you don't deploy them at the right time, you might actually be setting them up to fail. And it's not just a matter of, oh, now we'll get it sorted out, but they have to actually overcome a whole bunch of things that happened as a result. So those kinds of dynamics were quite interesting for me. We were focusing on different parts of it, but that for me was something that called out in terms of, it's not just expertise, but it's when it is being used, who is it, and how are these groups or these coordinating groups being set up? Where is their structure? Where do they sit? That's more subtle, but was very important. Okay, sorry. Oh, back to you, Tanya.
No, that's great. I have a follow-up question, Terrence. Many of the findings reported problems or shortcomings, especially at operational level, at field level. But at the same time, you were calling for some sort of senior level management response. Now, I have worked both in the field and at headquarter level. It would be really interesting to hear from you what response would be helpful, what response would you wish to see from the senior decision-making level at headquarter level. So what, for instance, response would you prioritize from the OPAC, which is the Operational Policy and Advocacy Group, or indeed from the principals themselves? You have mentioned a few during the contribution already, but perhaps you can spell this out a little bit further.
Yeah, well, I think to some extent, what I would like to see is they just adapt all our recommendations. So that would be the fairly simple question. I would say if you had to prioritize, I would say some key things to be considered would be funding for the expertise and making it a standard part of the humanitarian infrastructure, not an optional part. So what happens is gender often becomes seen as optional. But say, okay, it's just going to be standard operating procedure that every humanitarian response country team has a senior gender advisor automatically deployed at the beginning of the response at the HCT level, and that every cluster lead agency automatically has to put in a senior gender advisor if they're going to be the cluster lead agency. There's an inter-agency senior gender advisor resource, and that this becomes coordinated. Right now, it's more like the way it's treated is, oh, we'll use the GenCap, which is very useful, but they have to request the deployment from the GenCap, and it's a limited period of time. It's not a permanent position. And so setting up these permanent positions and just making it part of the structure. So just as you always have a lead coordinating agency or lead agency for a cluster, you also have to always have a lead senior gender advisor that's part of that role. Just as you always have to have an HCT, you always have on that HCT a senior gender advisor. So but that funding is not available at the moment. This sort of what's it called, admin funding. It has different terms in different places. But that's not available right now. It's not part of the structure. So making it part of the structure somehow would require principals, donors to actually allocate funding to it. So that would be probably my first one, and then my second one is just putting the gender accountability framework report, setting up some sort of structure for having a management response integrated into the reporting somehow. At the moment, it doesn't, and so it's just kind of left dangling. So those would be the two pieces, I guess.
Thank you, Terrence. Maybe you can spend a minute thinking about what else you want to put forward. But Ali, can I ask you to come in at this stage? We've talked a lot about now this particular IAHE, but perhaps you can give us a sneak preview, a teaser, so to say, about what's coming, what's the next IAHE you're looking at, what's in the pipeline.
Thank you. Thank you, Tanya. Just maybe one word about the follow-up to this one. And Judy said that, you know, to a lot of gender experts, it was like they knew a lot of things that were presented in the report. But I have to say, for someone like who is not an expert like myself, I learned a lot from the report. So I think there is a different audiences and, you know, which can help to enrich debate in different fora. So among the gender experts, among the policymakers, and the general humanitarian community. So in fact, this report generated so much interest, or even the early findings from this report generated so much interest that the interagency management group for this evaluation decided to do a follow-up study of integration of gender into humanitarian nexus. So this is ongoing right now and will be finalized in January. So that's one thing that you can expect from us in 2021. Another is the interagency evaluation of Yemen, of humanitarian response in Yemen, that was launched in February, was suspended due to pandemic, and it has restarted recently. So we expect we'll have it completed next year. And also there are some ongoing discussions on the possibility of conducting an IAHE of humanitarian response to COVID-19, which I'm sure would be of also very, would generate a lot of interest in the humanitarian community. So that's briefly our next priorities for the group. Over.
Okay, thank you very much. Terrence, I learned that unfortunately Mariangela had to leave us. She had to attend to some emergency. But I want to thank her very much for her very interesting interventions and presentations. So Terrence, I hope you can take that to her, back to her. Terrence, I would just want to ask, as we are shortly coming to a close, is there anything else that you would like to share? Any final takeaways before we close?
Thank you. Actually, I wanted to just respond to Marta and Veronica quickly here, because we should probably have clarified. We were looking at the interagency space, but there was actually quite a bit of progress within the individual agencies as well on gender tools, gender policies. So inside a particular agency, and inside these agencies, they also had. They also would deploy gender expertise, although, again, it was often in a temporary format. What seemed to be a challenge was connecting somehow this internal interagency sort of resource with the entire system. Like, so the coordination, the sharing, the actually applying it across time. So I think one of the things that individual agencies can do to ensure these issues is sort of apply the resources to an interagency level. Now, agencies usually prefer to apply the resources to themselves as opposed to share them interagency, but this would be a key piece, I guess. I think the other thing is just my key takeaway is the one I had said earlier, but it's not necessarily a problem of commitment or priority or interest, even though those often tend to be the default sort of reasons given by people when they talk about this. It's also, the solution is also not necessarily depending on voluntary leadership. If we look at other issues like global climate change, voluntary action doesn't seem to be sufficient to drive this, to address this issue. You need actual structures and policies. And so the solution, the reasons are not necessarily the reasons that people give, and the solution is not necessarily sufficient. So this issue of taking the next step, but recognizing that there has been significant progress. There is priorities, there is commitments, there is interest. And so that has been reflected, and it could be better reflected with a few extra tweaks. I guess I would say it that way. Over.
Okay, thank you very much. I would like to come to a close. Unless there is a final urgent question anybody would like to ask, then please do so in the chat. We've heard a lot of interesting findings on gender and from the various case studies. It was very clear some of the key recommendations that stand out is that predictable funding for gender expertise and ensuring sustainable gender expertise throughout the humanitarian system and throughout the humanitarian response at country level is necessary and required and is the prerequisite for enabling any form of transformative change. This is particular role, of course, where IC principles, but also the other IC structures can take action and could contribute meaningfully to the advancement of gender equality. Secondly, we have heard that we need to remove the systemic and strategic barriers to gender in the humanitarian system, and that needs to be by going beyond expressing commitments and priorities, but actually to taking actions. Now, that hurts a little bit saying that working for the IASC Secretariat, because we do take pride in taking actions every day and all the time. And we are trying to mainstream some of these extremely important key thematic issues. And I just want to express a commitment that we'll continue to do so and to try and help as far as we can. Thirdly, something that was loud and clear could be heard throughout the presentation, that gender accountability must be linked to results frameworks. You mentioned over and over again the issue of a management response, but unless we have it in results frameworks, in appraisal systems, it is difficult to monitor and it's difficult to assess transformative change. These are the key takeaways that I would like to list. If there is no other key important questions at that stage, I want to say thank you. Thank you very much, Mariangela. Thank you very much, Terrence. Thank you very much, Ali, for this extremely important and very valuable briefing. Do you want to have half a minute for any final words? Terrence, Ali.
Thank you. I think I've said everything multiple times. Sorry
Yes.
for repeating myself, but thank you very much. It's been great being here.
And
also appreciate it again. Thank you for all the work that you've done this year. And I think we had a very productive year despite all the challenges. Hope that everything we've done this year will help us to have more effective response in the years to come.
Okay. Thank you, Ali. Thank you, Terrence. Thank you to all our audience that took the time to connect. Stay posted. We're going to come up with future IASC briefings, hopefully of equally important and fascinating topics. So I hope to see you soon. And until then, take good care and all the best for the remainder of this year. Thank you very much and goodbye, everybody.